Hello, everyone.
Hello, Sasha.
Hi. All right. So, hi, welcome to Psychedelic Research and Therapy 101. We're just going to take these first 3 minutes or so just to wait for all the participants to come in, and then we will officially begin. But in the meantime, a lot of you will notice that there's a chat function to the right. So I just want to start by asking people where they're tuning in from. Where are you all from? I'm tuning in from Berlin. Okay, we have Valencia, Austria, Boston, Bethesda, Maryland, San Francisco.
Cool.
Wow.
All over the place.
Great. Gmunden, Austria. Yeah, that's it.
Yeah.
Yeah, do it.
Germany.
Heidelberg.
Honolulu. Wow.
So where did I put my glasses, by the way?
India too. Wow.
Cool.
All over the place. This is awesome.
But Honolulu makes my day.
I've never actually been there, but I've always wanted to go.
Yeah.
Munich. All right.
Like 10 centimeters more to the left.
I'm in the plant.
Oh, no, then keep it.
Okay, definitely lots of Europe, America, a little bit of Asia. Awesome.
Bethesda.
Bethesda, that's my hometown. I think I know who those people are.
Really? That's your hometown?
Yeah, and my parents are tuning in, so.
Wonderful.
Great. Okay, just one more minute. We're going to wait, and then we will get started. Thank you, everybody, for being patient. And Henrik, do you need me to enable your video or?
You need to enable my video. Yes, I can't do it by myself.
Okay.
Just get us in now. Yeah. Go down. Netherlands.
So it looks like I'm having trouble. I don't see an option to allow your video.
It says you had stopped my video. Probably not intentionally.
Let's see here. So I don't see an option to enable your video. Wait a second. Maybe Core, do you see an option on panelists?
Did you make me a co-host? Because I can only be on video.
You are a co-host. But for some reason the video is not. Do you want to try signing out and in? Sorry, everybody, for the technical difficulties. Thank you for.
We'll do that. We'll do that. Yeah.
Okay, great.
So Sasha, does it work now? I could
be able to start a video, your own video.
I can't start it because the host has stopped it. Should I try to log in with the Mind Foundation login?
Yeah, that could be a good idea.
So I'm logging out again.
Sorry, everybody. Thank you for your patience. Some technical difficulties. Hello to all the new people. Just give us a few moments. We're experiencing some technical difficulties, but we should be rolling soon.
Hi, Sasha.
Hello. Let's see,
So-
hopefully your video works now.
All
There
right.
we go. All right.
There we are.
Okay, great. Thank you, everybody, for sticking with us through those technical difficulties. Now we can get started. So I'm Sasha Silverberg. I'm the Director of Fundraising and Development at the Mind Foundation, and I'm going to be moderating this talk today. So this is actually our first webinar in a series of upcoming webinars. It's Psychedelic Research and Therapy 101. And yeah, we actually, so the Mind Foundation is based in Berlin, and we usually have in-person events, but ever since the Corona situation came on, we've been making everything online. So this is really our first webinar, and we're really excited to offer it to you. We have actually a series of really interesting webinars coming up as well. I think next week we have essential questions, medical doctors' perspective on psychedelics, death, and dying. So that's a really exciting one. And Andrea here is going to be giving that talk. And then after that, we have Heather Hargraves, Silencing the Default Mode Network in Times of Crisis. So that should be a really interesting one that is very clearly related to the time we're in right now. I just want to let everybody know that I am going to be recording this talk starting right now. So that's that. And yeah, just a few housekeeping things really quick before we get started officially. One, you'll notice that we have a chat feature to the right. So if at any point you want to say something and it seems relevant to the discussion at hand, after the talk, we're going to have a Q&A and we'll be able to answer your questions. There's a Q&A section as well, I think, at the bottom of your screen. That will be the preferred mode for sending your questions in. And I'm going to be moderating those questions through that feature. But if for some reason that doesn't work, you can also try the chat. But there tends to be a lot of questions at the end, so I'll try my best to get to as many as possible. Yeah, so pretty much the way this is going to go is Henrik and Andrea, our co-founders at the Mind Foundation, are going to be giving the talk, Q&A at the end, and that's pretty much it. So I'll let you two take it away.
Thank you very much, Sasha.
Thank you.
Right.
You signed it.
Well, you have to share the screen first, then we can get started. Perfect. Right. Thank you, everybody, for being with us tonight. We have started or decided to kick off this series of webinars with an introduction to psychedelic therapy and research. So basically, a Psychedelics 101. We're trying to break down things, well, starting from the basics and taking you on a little tour of what we think is relevant in the field. Also talk about historic aspects, a bit about current research and implications, and also giving you an outlook to what's going to be happening in the future. just to let you know who we are. So this is Henrik Jung-Aurele. He happens to be my husband, apart from being the founder of my foundation.
How did that happen?
It happened apparently. So he has been a health and drugs researcher for 25 odd years now.
20. Don't make me even older than I am.
Well, right. So he has been head of a working group at the University of Heidelberg for 18 years, or working there for 18 years and being head of this working group on drug science, ritual use of substances like ayahuasca already like 10, 12, 13 years ago, when people were not talking about it that much yet, when it wasn't the big hype it is today. And he is also an author. You can see some of the books we being a number of people having written and edited here on screen now. And he, with help of many others, including me, founded the Mind Foundation about 3.5 years ago. And we've really been going strong. And we're very happy to have you here tonight.
Yeah, welcome. This lovely woman to my left is an anesthesiologist, intensive care and emergency doctor. She has worked with us in psychedelic science in the last years. She is the medical director of the Mind Foundation and the newly founded Ovid Health Systems organization. She has more than 10 years of clinical experience in emergency medicine. And since 2007, she is deeply involved in teaching medical students. That used to be the case at the University of Heidelberg when we worked together. And now we're teaching all kind of stuff to mental health professionals and people who want to engage in self-development and other things. Right. So what's the Mind Foundation? It's basically a science and education organization that promotes the development of psychedelic science. And not only the science, but also its application to practice in order to facilitate human development, health, and well-being. We do so because we believe in science and research to be the right instrument to provide us with the data for the evidence base that we need for these interventions and policies that will bring psychedelic therapies into the mental health system. Short facts, we are a little bit older than 3 years. We have started an academy with already more than 70 events going, some of them CME certified. And we have a members association with more than 500 people from all fields with a special focus on mental health professionals. Yeah, and I think that's our way into the talk, which is an introductory one. We can get deeper with in the question and answers if you like to, and in the next webinars that we are providing. Psychedelics have to be taken serious. Again, something started in the 1950s, 1960s, when researchers were really going to develop a science, different scientific perspectives on this interesting field that stopped in the early 1970s. But it began all again after around the year 2000. And we have built a group here in Europe, in Germany, that tries to kickstart something here that will help the development of this field.
And we are multidisciplinary in the sense that we don't only focus on basic science or clinical application, but we also try to include a human development perspective and philosophy and neurophilosophy into this, because we believe that working with these substances needs a thorough threading below it that can support it with different perspectives, not only from natural sciences or medicine, but also from the humanities.
Yeah. So today's talk, or the reference, the empirical stuff we're going to provide, is going to focus a little bit on the medical field and the pharma studies going on. But in reality, we believe that we need all these disciplines to get a more complete picture of what psychedelic science is going to be, including philosophy. So one of our main concepts in the Mind Foundation is that wonderful German word, Bewusstseinskultur. So the neurophilosopher Thomas Metzinger came up with it. And it basically says these three things. We should apply an ethical attitude towards our own mental processes. Now, those of you who are deep in the philosophy of the history of philosophy and the philosophy of mind know that something happened around Immanuel Kant when we somehow developed an understanding of the human mind that became more and more rationalistic, cognitive. So a Bewusstseinskultur, a culture of consciousness, would expand that view on the human being to integrate all the other things, humans being bodily, embodied beings, affective beings, social beings, and add that to Bewusstseinskultur. So taking an ethical attitude will then be followed by a systematic cultivation of those states that we consider valuable. And Thomas Metzinger calls it a secular ethics of consciousness. As you will see, or as you have seen when you visited our Insight conference and others, we are not so much about metaphysics. We think that we have a lot of things to do to work on in this world here that can also create secular spiritualities. But that's only one aspect of the whole concept. And then the third step is, if valuable mental states are identified and we agreed on it, we should build institutions and social forms around it. So that is one main concept that guides us, and that's the structure of our talk.
Right, so just to give you a rough idea, we are planning or intending to talk between 45 to 60 minutes. 45 minutes might be a bit conservative, considering the fact that we usually get into storytelling and anecdotes too. So just bear with us, and we can still have a very good Q&A session afterwards. What we will talk about firstly is psychedelics and all sorts of consciousness in psychotherapy and research. I'll give you a rough overview over these things. Then introduce you to modern research on psychedelics, talk about a few studies happening, a few projects that we have.
With a clear focus on psilocybin, because the field is really large and we just needed to get a focus in it.
So we zoomed in on that. And afterwards, we're going to give you an outlook on upcoming research, also considering the study we're planning, and talk a bit about the ethics and enculturation issues that will arise that are very important to talk about. And then we have the Q&A.
Yeah, it all starts with, what are psychoactive substances? So they are such substances that temporarily alter perception and experience, and following that, change people's behaviors, or let's better put it the other way around, people change their behaviors by ingesting or somehow consuming these substances. They are basically, that's nothing new, but we start from the start. We promised that. So there are basically three different classes, typologies of substances. These are stimulating substances, central nervous system depressing substances, and somehow those substances that create something inside the mind that can be called like daydreams, induce waking dreams, strengthen inner processes, accompanied by insights, metacognition sometimes, and they have been called hallucinogenic substances or psychedelic substances. It is really hard to categorize those substances. Categorization, putting things into the right category, is a central part of the scientific endeavor. But when it comes to classifying those substances, sometimes we have large intersections. Some people try to do that by their pharmacological mechanism. Other people try to do that by their phenomenology. So what people experience subjectively. But just to give you an example, for those who are a little bit familiar with the field of psychedelic substances, MDMA, for example, is clearly not a serotonergic hallucinogen. It's not a classical hallucinogen. It's a stimulant. pharmacologically. But when you get to the phenomenology of MDMA, some people experience, at least at the beginning of the use of MDMA or in a psychotherapy, when they take it once or twice, they have psychedelic phenomena like daydreaming, changes of time perception, insights that cannot be compared to everyday consciousness. So just to remember, it's hard to classify these substances. Some are very clear, some not. And second message of this slide is, of course, antipsychotics and depressants are also psychoactive substances. Why so? Because they act on the central nervous system, because they change people's perception of themselves and the surrounding context. And not to include those substances in the family of psychoactive substances is rather an ideological or historical decision. And I think for the sake of clarity and neutrality, we should include them in this family.
Right. So when we talk about psychoactive substances, we should be aware that they all carry risks. There is a narrative in the general public that psychoactive substances, psychedelics such as mushrooms, MDMA, LSD are very dangerous. There are those stories from the 1960s, 70s about people jumping out of windows, which might have happened. It's something that is...
It has happened.
It has happened.
Yeah.
Or people, for example, who have very drastic reactions to other substances, like, for example, at the last Burning Man, somebody ran into the fire and died, who was apparently on psychoactive substances. These things are possible, but it's not that likely, to be honest. And if you look at the graph you're seeing now, this is David Nutt's study that was, among other things, published in the Lancet. And what he did, he asked 40 people, experts, to sit together and establish two things: the risk to self and the risk to others that is carried by psychoactive substances. They did the real thing. They included everything that is common. So talking about also alcohol, amphetamines, tobacco. And if you look at the risk profile, if you add it up, you can see that, for example, alcohol in the accumulated danger for self, like having an accident when you're drunken, or developing liver cirrhosis, or whatever can happen on alcohol, and the risk to others, like having an accident, injuring another person, being aggressive, physical abuse that sometimes happens when people are alcoholized. So the risk here is far, far higher than, for example, it is for psilocybin, LSD, and ecstasy, which are very far down there. So there's some risk to self, but very little risk to others.
It's actually not trivial to rank psychoactive substances like that, but the multi-criterion decision analysis that David Nutt used here is probably one of the most rational instruments to get all the very complex data around these substances together and create something like that.
Create something rather objective.
Rather objective, based on expert decision-making, of course, because when it comes to bringing data together, this is not something that machines do well yet.
Right. When we talk about those substances, we are in the middle of the terminology wars. We have to be aware that what we call something shapes how it is in the world and how it is seen. So these substances, like psychoactive substances, have been called by very many different names. They're called drugs. Some of them are called narcotics, addictive substances, which is, for example, not true for the classic psychedelics due to their mode of action, medications, neuroplastogens, even entheogens. And we really like to stick to psychoactive substance, again, because it's one of the most neutral terms to use in this context. And we would really like to strive to not, praising these substances too much by giving them names that don't really fit with them being active substances on the central nervous system, and also not by using this term that would be derogatory. Right, let's move on.
Yeah, one element of the subjective side of experiencing some of these substances is immersion. So a lot of people feel immersed into states that could be emotional, that could be very cognitively focused, that could also be confused. Another thing on the very top end of what can happen when under the influence of some particularly psychedelics, but not only, is what people started to call the mystical experience. They started to call that like that in the 1960s, and we're going to hear about that later when we come to the empirical results of some of the psilocybin studies. We are actually not a friend of calling these states mystical experience because, alluding to what Andrea already said, it is somehow bringing the whole history of theology and Christian background into it. That is actually not necessary. It's not taking away anything from the very interesting and meaningful states that can happen when psychedelics are taken in a professional context. Yeah, but also another message related to that slide is we will be looking at the topic from a third-person perspective, that is objectifying or intersubjective, and the first-person perspective. So subjective feelings, perceptions, stories, narratives have become part of the scientific endeavor for a long time, to bring the phenomenological world, how it is called, together with some more objective data from fMRI scans or something. It's hard, but it's being done.
And it opens new perspectives by combining it, that more inclusive and more precise.
Yeah. Well, these states can be very different when you look at the whole spectrum of psychoactive substances. Of course, things like psychosis, hallucinations, delusions, depersonalization are there, and particularly under the influence of psychedelics, some people may experience something like that from this part of the spectrum. On the other end of the spectrum, of course, there is connectedness. If you look at the little picture on the right side of the slide, that may symbolize an MDMA-like state that some people experience, at least when ingesting the substance in a good context, an experience of closeness, of losing anxiety, to being close to other people. And the message of this slide simply is the spectrum is huge of what people experience, and it's not just intoxication.
Right, but when we talk about psychedelic states, we would like to, or altered states of consciousness, we would like to also mention that there are very many ways of reaching those states. So you don't necessarily have to use a molecule. There are pharmacological techniques that go from simple things many people experience without really thinking much about it, like runner's high, to very, very sophisticated trance and meditation techniques, or very
like breathing in yoga, or Tibetan breathing methods, or fancy meditation techniques. Yeah.
And there's also a whole array of instruments that can be used, like floating tanks, to induce the states. But today we're going to focus a bit more on the pharmacological side. We have named here like the most important pharmacological tools for altered states of consciousness. And not all of them are psychedelics, of course. Many are, some others are like bordering on it. And with this pharmacological spectrum, you can reach most states we have mentioned before.
By the way, we're not telling anybody that she or he should or is supposed to experiment with altered states of consciousness. That's not the thing that this science and this attitude is about. Our approach of Bewusstseinskultur tells you all that there is to say about it. So there are valuable states, and valuable states are usually not those states that destroy yourself and your bodies, but that help you to become a fuller, more complete, a happy human being. Other animals take drugs too. The whole history of regulating substances by prohibition in the last 60, 70 years has shifted the focus away from the whole story. The whole story is that there are many species on the planet, birds, dolphins, cats, dogs, elephants, mice, many others, who ingest one or the other psychoactive substance sometimes, and there are species that are notorious for doing so, like elephants. I can only recommend that you take a look at that, I think BBC video on YouTube that shows us how adolescent dolphins,
Male adolescent dolphins.
Only the males, again, the males ingest the toxin of the pufferfish, show some behavior that we may interpret as intoxication, then hours later come back to the same pufferfish, which they didn't kill, and do it again. So there is a planned behavior in a certain period of time that seems to have some biological function. I think we should talk about biology, if that is a behavior that is so far-stretched across the planet. And there's this wonderful text that I can only recommend to you by Müller-Schumann and others. And these are the functions of using psychoactive substances that they see in many species to facilitate social interaction, facilitate sexual behavior. Biology is about sexual behavior. We wouldn't be here otherwise. To improve cognitive performance, increased alertness, is it? Facilitate recovery and coping with mental stress. By the way, that's a motif where many people get caught and hooked up with some of the more addictive substances. By the way, psychedelics are not addictive on a physical level. There are some that come close to it, but they are not addicted on a physical level. And the psychological addictiveness of psychedelics is very low on a scale. Other motifs are self-treatment, self-therapy, of course, enjoyment, euphoria, and improved physical appearance and attractiveness, which is somehow related to the sexual behavior thing. Well, finally, that took a long time. Psychedelics, history and modern research. Your part?
I think so. Right. When we talk about psychedelics, we are talking about substances that basically work by affecting the 5-HT2A serotonin receptor in the brain. So this is kind of where they all come together. Most substances also affect other receptors in the brain, but the classic psychedelics are usually being
defined by that.
Defined, or they're categorized by affecting this specific receptor. What does psychedelic mean? Psychedelic could be translated from the Greek as manifesting the mind, manifesting what is within. Another translation sometimes is manifesting the psyche, but it's more about the mind, which is a bigger thing than that. So the classic psychedelics we know that are being used in different contexts, from shamanic over recreational over now scientific and medical, usually are LSD, psychedelic mushrooms, also mescaline from peyote and San Pedro, or DMT containing substances like ayahuasca and yopo. Ibogaine is a bit special there. There are hundreds of novel psychoactive substances basically created to avoid illegality and being pushed in the market, and some of them are far more dangerous than the classical ones.
Yeah, and can even kill you.
This is what most people think they know about psychedelics. There is a strong cultural narrative dating back to the 60s and 70s. There's even the musical Hair around all of this. And basically people have an inner image, but the general public is not really aware of what really is around psychedelics. Every now and then new topics pop up. So microdosing is all the rage now. What it really does, we will see in the future. There's still a lot of research to be done. Mainstream authors like Michael Pollan have done a good job of bringing these topics closer to the general discourse. But let's have a look on how this all came into being. Well, the psychedelics basically went from the scientist's desk. Here you see Albert Hofmann, the person who invented, discovered LSD in his research for other substances, working with ergot mushrooms. And this was 38? He synthesized in 38 and shelved it till 42, and then the whole thing.
In 1946, on the 16th of April, he unintentionally ingested a very tiny dose of LSD, and then created a self-experiment on the 19th of April. And then he found out about the psychoactive effects of this substance. There is a hidden history of psychedelics in Western culture. There is a hidden history beyond Christianity and even within Christianity. But that is not the topic of this talk tonight.
So basically what happened then was that not only LSD, but also mescaline and psilocybin were present in the medical world. They were being used by doctors trying to learn about psychosis. So it was used as a psychotic mimetic. Doctors and psychotherapists used it to feel states of consciousness that they attributed to mental illnesses. And also from there, it went basically, we're not going to talk about all this now, via the whole Harvard track. It went into subculture, where it stayed for a long, long time. So you had Ken Kesey, you had Terence McKenna, all these people. And it is a cultural reality since then that psychedelics are being used in different contexts, for self-exploration, for recreation, for therapeutic uses.
Much more than 30 million Americans have used psychedelics once in their life. More than 12 million Europeans have done so, very different in the different areas or regions and countries of Europe.
So there is a cultural reality of psychedelics use, and it has gone back into science since around 2000. The first attempts to keep it in the focus of science, like in the case of MDMA, were already made when it was made illegal in the 80s. So MAPS has been working on re-establishing MDMA as a valuable substance for psychotherapy ever since then. Other substances like psilocybin and LSD were not researched much for a long time, but have had a strong comeback with many, many working groups working on the indications you see there and many others. We're going to point out a few working groups regarding depression later on again. And this is something that is happening actually in more than 30 universities around the world now, and on top in some other practice studies.
And not to forget that little country, partly German speaking, where LSD was invented, they have a history of...
He's talking about Switzerland.
Switzerland, yeah. They have a history of research on LSD and psilocybin that actually never really stopped and began to accelerate with the works of Franz Vollenweider in the 1990s.
Right.
Yeah, upcoming here in Germany and adding to the larger tradition of psychedelic research in the world is our more and our larger high quality studies all over the world. Private companies and universities are starting phase 2, phase 2B, and very soon also phase 3 studies. This is an expression of how to get approval for these studies in the medical world. So that's the track where everything started to become interesting again. In the last 15 years, there are studies that have not been conducted in the 1960s and 70s to recreate some of the classical psychedelics and new substances into medication that can be used for psychotherapies and beyond. New molecules in development. I just talked to a large company in the field who is well known developing psilocybin also. And they say that they would be working on more than 200 new molecules. Adding with the others that are working on it, there are hundreds of molecules being looked at and developed in the moment. There's also something developing that can gradually now be called a psychedelic industry. It calls himself psychedelic industry. So investment is coming in, big money gets in, sometimes from the cannabis field or from donors, from philanthropists. That is changing the situation considerably. You need 50 to 100 million at least to develop something into a substance, into an approved medicine. And that is very low cost compared to what the pharma industry usually does.
So whereas psychedelic science used to be the endeavor of underfunded but very, very passionate people, it is now turning into something that comes with money and has also the possibility to turn difficult in the way, for example, the cannabis industry has turned difficult in recent years.
Not only you need money to do research. So let's focus a little bit more on one of these substances. So Albert Hofmann has played a role in finding the active or the most active, the prominent psychedelic compound substance in mushrooms, in some form of mushrooms. Actually, their ritualistic use reaches back more than 6,000 years in modern times, particularly in Central America, and the isolation was done by Hofmann in 1956. 58, yeah. I have to use my... So research interest has been growing again since the 2000s, and probably psilocybin, if the studies in phase 3 turn out to be doing what they promise to be doing in the studies so far, work on depression, psilocybin will be the first psychedelic that will be out on the market to be used by psychotherapists and medical doctors. There is lots of research going on. When we say lots, don't fool yourself and don't let yourself be fooled when you compare it to other fields of research. The field is still small. So there are a lot more people doing research about depression in general with many other substances, including SSRIs. So it's a growing field, but it's still in its infancy sometime. But we have big journals now publishing papers about it. It's in science, psychopharmacology, neuropharmacology, a lot of journals. So this is to be taken serious. And if they don't work, people also have to show that they don't work, because there is good evidence for a role of psychedelics in the treatment, not only of depression, also beginning to play a role in the treatment of substance use disorder, alcohol use disorder, and other indications. These are basically the teams that are working on the psilocybin and depression topic at the moment. The researcher to the right is also the only person in the medical field who is currently working on human clinical LSD studies. There are others who are working on more basic science, neuro studies, or animal studies. So psilocybin is paving its way. So it's a 101 talk. We're not getting into the deeper science. Was it your slide?
Oh, keep on.
Keep on. Yeah. So we're not getting into the studies very deeply, but as you can see in these modern studies, people are taking the same instruments, endpoints that are used in SSRI studies and in psychotherapy studies like the Beck Depression Inventory. And we want to point you to only one aspect that is most interesting about these substances. They don't have to be taken regularly. They even can't be taken regularly. The low profile in addiction, in substance use disorder that these substances have, has to do with the fact that if you take them regularly, you will simply not feel an effect anymore, even after taking in even higher and higher doses. This very quickly ends. Next thing, only 1 or 2 doses have been shown, at least in some people, to show depression relieving effect for 3, 6, and many more months.
That was your slide.
That was mine. So
keep on.
Take mine, please.
I know.
Okay. Very interesting and a little bit confusing to traditional researchers in mental health is that some people say that these substances induce spiritual experiences in them. Now, the term spiritual, of course, is used very differently. If you are part of a denomination of a religion, you certainly have a tendency to think that that is spiritual, what you do there. There is a broader way of using spiritual. But what it means here is that some people who went through their first, usually drug-naive patients, through their first experience, they tell us that it was one of the most meaningful events that they experienced in their life. And that would be something that cannot be described by the term intoxication only.
Right. So what we've got here is a quote from the New York Times. This is actually a report from one of the patients in one of the Johns Hopkins psilocybin studies. This is not out of a depression study, but this is from a study for patients with anxiety connected to life-threatening diseases, end-of-life anxiety. So people that are afraid of dying because they are very sick. And I would like to read it out to you. Reema took the psilocybin at about 9 a.m. and its effects lasted until about 4 p.m. That night at home, she slept better than she had in a long time. The darkness finally stopped scaring her, and she was willing to go under, not because she knew she would come back, but because under was not as frightening. Why she was as afraid to die is hard for her to explain. I now have the distinct sense that there is so much more, she says, so many different states of being. I have the sense that death is not the end, but just part of a process, a way of moving into a different sphere, a different way of being.
We could probably have a discussion about this phenomenological piece for a whole hour longer than that, because there are many things in it that need to be explained that are not simply explained by the term spiritual. Yeah, subjective elements can be demonstrated, documented by texts, by oral communication, but the modern psychology invented instruments like the Altered States of Consciousness questionnaire that tried to distinguish the experience into, in this case, 11 categories, like audio, visual synesthesia, vivid imagery, insightfulness, experience of unity, blissful states, anxiety. And it goes without saying that not every experience related to the ingestion of a psychedelic or psilocybin in that case would lead to a good therapeutic result. But there are certain experiential characteristics that are more connected to a good therapy outcome. Let's not forget, yeah.
And it has to be said that even those people had their psilocybin experiences under supervision, treatment, or very experienced therapists in a very safe environment. Most people at least had phases where their experiences were difficult for them, where they experienced some anxiety or impaired control of cognition. And actually, this is something that people, when they talk about, yeah, but you could have a bad trip, are very negative about. But actually, for those patients, when you look at the outcome, sometimes it was necessary to get somewhere else. And in the overall, even those people who experienced strong phases of those emotions did not rate them as very negative after their experience.
Yeah. So yes, basically what I just said, the quality of the psychedelic experience predicts therapeutic efficacy, at least in the studies of the Griffith group, but also in others. So the actual function of a facilitator, of a doctor, medical doctor, of a therapist in classical or traditional settings may be of the shaman, but I am not of the opinion that the medical doctors and therapists that accompany these patients are modern shamans. We could talk about that maybe in the question and answers. The function of these people is to enable the client, the patient, to let go into an experience that is therapeutically valuable. We've talked about clinical effects and clinical studies. Let's not forget that beyond clinical studies, there is evidence for psychedelics being effective or useful in non-clinical contexts. That's also part of the story. Also, the set and setting argument, the contextualization plays a role in this argument. So in the studies, we wrote an own critical review about it 2 years ago. 7 elements have been shown to be showing in some part of the population. So it's not the case that the people, when people ingest psilocybin or ayahuasca or LSD or DMT, automatically develop these outcomes, but that some did it. So openness, and that's a very astonishing thing. If you measure a personality factor being changed for a longer time, after maybe only one ingestion of a psychedelic, that is something completely unfamiliar to psychiatry and psychotherapy. Other characteristics involve cognitive flexibility, creativity, problem solving, well-being, life satisfaction, pro-social attitudes and also behaviors, changes in life values and orientation, and the so-called psychospiritual experience, and sometimes also related to mindfulness. There's an actual very interesting relationship between mindfulness and the usefulness, the long-time usefulness of psychedelic experience.
Right. So we've spoken a bit about psilocybin and depression being the indication being researched the most at the moment. But why is that? Well, firstly, depression is a terribly common problem. Very many people around the globe at one point or the other suffer from depression. 1 in 8 women in Europe is going to have one depressive episode in her lifetime where she qualifies for the diagnosis of a depression. And there are substances and therapies that work. There are concepts like combining CBT, so cognitive behavioral therapy, or depth psychological therapy with antidepressants, often SSRIs, which also work on a serotonergic system. And this helps many people, especially in the combination, but for others, it doesn't really work. And the next thing, people who have taken antidepressants discover they cannot quit, that they have become addicted, in fact, to their antidepressant. And when they try to taper off, when they try to stop using them, they have terribly rebound depressions afterwards.
So after all, it's not a perfect treatment, and many suffer from side effects.
And the fact is that the amount of antidepressants being prescribed to patients has been rising. If you have a look at this green line in the graph, there you can see the development going from 800 million daily doses in 2005 to over 1,400 daily doses.
And this is only this tiny country, Germany.
Yeah. So in the last 12 years, or within the 12 years on this graph, and this has been continuing. Antidepressants, as I said, can be addictive, and often they are, as only training, not effective, and they have side effects. And these side effects can range from emotional, even if they work and make you less depressed, they can make you emotionally dim, they can affect your libido, they can make you less yourself, like being wrapped in cotton wool in your daily life. And many people, if they can, quit those substances because they don't want to cope with the diminished life quality they bring along.
We are not against these substances, and as researchers and experts in mental health, or practitioners in mental health, we know that many people feel relief, they are helped, they experience improvement in their situation. But definitely, when you look at the more than 312, the WHO said 312 million people who are diagnosed with this depression, it's clear that these substances are not the solution.
Or not the only solution.
Not the only solution. Yeah, so let's wrap it up before we come to our third, the outlook and part of the talk. How do psychedelic-assisted treatments work? We extrapolate a little bit from psilocybin, and they have two levels of how they work. That is the phenomenological experiential level, and that is a neuronal level. Yeah. So the phenomenological level is they increase the context sensitivity of people, thereby help them to create different other behaviors that they couldn't develop so far. They provide immersive experience that for some, in the best context, provides them with the ability to experience connectedness. They have deep insights into biographical facts, into how they think about the cosmos. They change their cosmology. Some experience a loss of ego structures. It is in parts of the psychedelic tradition, it's called ego death. But if you really look at the phenomenon, it's not really ego death, particularly not for all. There are many steps on a spectrum of how people re-experience their ego. People experience awe for nature and for life, and they have something that is in other ways called mystical experience. The so-called bad trips are often considered challenging experiences. You can do that if people have the opportunity to be in a context around facilitators and around people who help them to reinterpret their experience like that. But for us, there is no doubt that there are situations and there are people who really experience bad trips that can lead to hospitalization and deeply frightening long-term states. Psychedelics improve or not improve, but they increase primary process thinking, leading to more material coming up that they can process, sometimes age regression, and they help in cognitive restructuring when that is the goal of the context they are used in. but they also have a neural level of working. That is going to be the joke of this talk.
Most definitely. Right, we already spoke about the effect on this special serotonin receptor, the 5-HT2A agonism, which is being found in all those classical psychedelics. There have been many new theories, discoveries, concepts on how to explain what is happening. And one is the so-called reset mechanism that is being proposed by the working group around Carhart Harris at Imperial College, who's talking about how psychedelics lead to a normalization of disturbed activation in the so-called default mode network, which is very deeply embedded in our neural structures.
And its function is to create a lasting reality of ourself and how we perceive the environment. That in case of somebody who is suffering from depression can be deeply disturbing because it's not getting him out of his, for example, rumination patterns.
There is evidence for increased neuroplasticity at the moment, mostly in petri dishes. So this has still to be proven in proper brains.
You mean human? There are many proper brains in evolution. I think
it has actually not been shown in any primates or so on. So it's like, I think there is some evidence in mice and in petri dishes and in some organoids, which is like mini brains that are especially created for doing this research. But in like highly structured brains, it has not been shown. It is likely, but it has not been shown. And one of the reasons why this heightened neuroplasticity could be taking place is because of BDNF, so brain-derived neurotrophic factor, being released. Right.
Yeah. If you want to dive into the things we said about experience, you might want to read our text that we published, the text of our research group that we published lately in Frontiers in Psychiatry, which is about acceptance and avoidance, experiential acceptance and avoidance being part of the success of psychedelic therapies.
This being placed here to show that there are developing and new models on how to explain the working mode of psychedelics.
Also bringing psychedelic therapies together with the cognitive behavioral tradition, which has not been done in the past, and I think interesting debates are coming up there.
And happening already.
Yeah, outlook, upcoming studies, ethics, enculturation. A little bit deeper on the study we are just planning together with Professor Dr. Gerhard Gründer in Mannheim.
And a working group from the Charité Hospital here in Berlin. We are currently in the phase of handing in the paperwork for getting the license to do a psilocybin depression study here in Germany that is supposed to, or that is called the episode study, which is that as efficacy and safety of psilocybin in treatment-resistant major depression. So another depression study, because this is really the major thing where there is the wedge in the tree, and if we all work together, we might make the tree fall and get to where we want to get.
Where do you want to get?
A beaver analogy, by the way. No, towards having psilocybin approved as an active substance in psychotherapy, so an adjunct to psychotherapy in depression. The study we're planning is going to be a double-blind randomized controlled study, which is a 2A study to prove efficacy and safety. So if you want to get a new drug, a new medication on the market, you have to have phase 1 studies, which are basically about toxicology and healthy patients. Phase 2 to show that it works with, so it has the participants. Then it's phase 2A to show that it works with patients of the disorder you're working with. 2B to find the right dosages. And in phase 3, you roll it out to show that it also works in large samples. And this is between phase 2 and phase 3, is where psilocybin research is kind of hanging at the moment, and hopefully after Corona is moving on. So what we're planning is to have 144 participants in a 3-arm study design in 2 centers, so Mannheim and Berlin. And the verum is going to be 25 milligrams of synthetic psilocybin versus 2 active placebos, so a small dose of psilocybin, and niacin, which is a vitamin that actually induces some physical effects like flush, feeling of inner body heat. And this is specifically interesting because all the studies who worked with the 5 milligram placebo, as they thought, were not on the same wavelengths, talking about smaller dosages and even micro dosages. So we want to see if we need the high dose, or if there is also an effect in the small dose, or if we need a proper placebo to show the effects we're searching.
For those interested in science, we should remark that placebo research with psychedelics is, of course, a very different endeavor. It's maybe an impossible endeavor. We stick to the paradigm that is there in the pharma research. But of course, in most of the cases, but not all of the cases, the therapist will know after some time.
The patient.
And the patient too, if he has ingested a psychedelic or not. But we don't believe it or not. There are a lot of papers out now, not a lot, some papers out now, that make us see that some patients develop psychedelic states even without having ingested the substance. So it's not in all cases that people know they didn't get the verum.
Our study is also special in the way that due to our crossover design, we can guarantee to all patients that they will receive at least 1 full dose, some of them 2 full doses of psilocybin in the course of the treatment. And what we are having, as most other people with different intensities, is preparation sessions, dosing sessions, and integration sessions that last for a total of about 12 weeks. We are working with mixed funding, and we're still in progress of the funding. So there's public money, donations, and also investment money coming in.
Yeah. How, if these substances show to be working in phase 3 studies, how are they getting into the mental health systems? Drugs. Yeah. So there is that famous person who is said to have said that drugs are substances that cause irrational and very emotional reactions in those who have never taken it. But unfortunately, as probably all of you will agree, they do also show that in such behaviors in those who take or administer them. So we have to deal with a lot of problems in this course too when we think about implementation of these studies. Let's talk a little bit about the challenges in developing safe and legal frameworks for psychedelic treatment and self-exploration. We put self-exploration also here in the heading because it's clear that millions of people are taking psychedelics for self-exploration and recreational purposes, not the same. Yeah. So being able to offer these people harm reduction settings that help them to maybe reach something they can't reach by a recreational use would be one thing that we should take a closer look at in science. So the challenges are developing forms of psychedelic treatments that are actually working within the modern mental health systems. We, the two of us, and the Mind Foundation people in general, there might be other voices in our organization, but in general, we don't believe that psychedelic therapies should be or can be built on the outside of society. They should become somehow, not somehow, we have some instruments at place, they should become a part of the pharmacopoeia of modern medicine.
They need to be integrated into a system that should move to accommodate it.
Yeah. And the other thing is that makes it hard for some people coming from the more skeptical, conservative side who have never thought about psychedelics having therapeutic quality. There are some undesirable developments in what might be called the psychedelic movement. There are undesirable developments in underground practices, in religious and esoteric groups, in recreational use, We didn't say that all of these practices and all of these people do things that are undesirable, but there are phenomena that we need to talk about openly. And at least we in Germany, in our conferences, we try to create an atmosphere where we can talk about these undesirable developments. So what are these? We can't go through all of these. Maybe let's touch it in question and answers. There is a tendency of some, particularly in underground theories, to develop a guru therapies, to develop a guru self, to cater to the breakthrough fantasies of some patients. Anybody who has ever treated a patient who came up with the fantasy, well, or who came up with a self-description, well, my therapies don't work, I think I have to take LSD, knows what I'm talking about. So the breakthrough fantasies are often another way of fooling yourself. Sometimes it happens. Sometimes people find these experiences, but very often they do not, because it's a part of their psychological mechanisms of suffering, that they are waiting for the last big thing to happen that will take all and everything from them, maybe all the responsibility from them.
A friend of mine once introduced me to the concept, or to the idea of ego transference. So if the patient experiences ego dissolution, it blasts the therapist's ego out of proportion.
Probably. Maybe some of you know the term spiritual bypassing, briefly described as using spiritual terms and feelings and narrations to skip everything that needs to be done in your life, to keep you from, to avoid what actually needs to be done to get better. So that is also part of the system. Let's talk about it if you're interested in the question and answers.
And there's one last point that is worth mentioning. These therapies and the way people get dependent on facilitators, therapists, shamans, gurus can make them very vulnerable. And there has been abuse, emotional, sexual, physical abuse. And these things also need to be addressed. They are being addressed by some people in the field now. And it is very important to keep an eye on these things, because especially being underground, being illegal, it leaves very little opportunities for victims of those practices to turn to the official structures that could otherwise support them.
These the phenomena you're talking about are not unique to psychedelic therapies or underground practices, but they are special in that field because of the role that this enhanced and intense experience plays.
And the fact that the substances that are being given are illegal.
Yeah, so experience is always part of a cultural context, and building the normative side, positive, strong and healthy norms around psychedelic treatments is one of the things we have founded the Mind Foundation for, and others have founded other organizations for. There is an individual and a social cultural side to building those contexts, and the individual side may be called integration. And to describe it briefly is which methods, skills, cultural context support a person in making something out of a psychedelic experience. And the social cultural side is how can we define the best surroundings for positive, long-lasting, sustainable development in the midst of a globalized, digitalized, postmodern society. I am personally, I'm not speaking for anybody here, very skeptical about traditionalist approaches which claim that going back into some form of traditional religious or traditional practice from the Amazon or wherever will be a solution to these problems of enculturation.
Right. So to round this off, we've been talking for a while now. I would like to introduce a bit more to what we do at the Mind Academy. So the Mind Academy is our educational platform that usually includes public talks in person, or as now in form of webinars and online seminars. experiential workshops that we're going to talk about in a moment for a bit, and trainings. So we're trying to have a platform that offers education, inspiration, and knowledge on very many levels, not only for the general public, but also for scientists, for therapists and doctors. And also we're trying to implement this thing that we have already pointed out to you, this culture of consciousness, Bewusstseinskultur, to make it clear to people that you are in charge of your own consciousness. You can do things about it. And
we should maybe improve on spelling the word consciousness, shouldn't we?
Consciousness.
Yes, I think
Consciousness.
I think that would be good for everybody.
Okay, it's a good.
So, okay.
Right. So one of the programs we want to specifically point out to you, because it's being moved online now in Corona times as well, is the drug science program. The drug science program is very new, brand new, not to, so to say. So we have finished it just this year, and we're in 5 modules, being of 8 units of length each. We teach things like basic knowledge on psychoactive substances, but also drug-related emergencies, which is a hugely important topic. We're going into depth onto pharmacology and neurobiology. We're doing a specific module on psychedelic substances, and we're trying to wrap it all up by doing the first module, which is on history, drug law, and culture.
Then we have an integration program that is more the transformative learning side. So we try to help people build skills with which they can improve what they learn from psychedelics. So this is a wonderful course that is there for people who are telling us that they might have experienced something with a psychedelic 10 years or 20 years ago. Now they want to get into it again, or they are part of a festival culture, and they experience problems in getting along with the experience. The course may help them to do so. It's not a therapy; it's a self-development course. Or others are preparing for a psychedelic experience in whichever context, and this course could be a harm reduction and informational context for that.
Don't forget Keshoka.
Keshoka is an integration therapist program that will start in autumn. And we are actually training psychotherapists to help people who come into their practices with the problems that I was just talking about.
So this is not about giving people psychoactive substances. This is not psychedelic therapy, but integration therapy training.
Yeah. And last but not least, we are working on creating a center, a psychedelic treatment clinic and center for human development at the outside of Berlin, in which we will work together with universities, doing studies, treating people, helping to do everything that we talked about in this 101 talk. And we are all very curious to set up a space where we can work with altered states of consciousness, non-pharmacological, also with pharmacological methods, all legal. We are not going to work with substances in illegal contexts, because that is not part of our vision. We want to get it into culture. And the Ovid campus that we are thereby building is also designed as a place where public debate on Bewusstseinskultur and everything around psychedelic states can happen and will happen. So this is one of the main things that we will be working on in the next years, probably, with the Mind Foundation and Ovid Health Systems, our partner organization. I think that's it.
All right. Yes, I was just about to say, I want to make sure that we get to people's questions. Thank you guys so much.
Cool.
So, okay. Okay, great. So we're going to start. So it looks like some people have already submitted some questions, so I'm just going to go through some of these and ask our experts. Okay, so first question is from Stephanie. Is there a political will to foster studies about psychoactive substances? And if yes, why do you think this changed in the last years?
It depends on if you're speaking in global terms or regional terms. Yes, there is a political will to foster that. There is also the will not to do that, but it has certainly grown. Why has it grown? Not because of political campaigns. I think exactly because of the research we have been providing a little detail of. So we have neuro studies, we have psychological studies, we have phenomenological studies out. People are working hard to demonstrate to others that these substances have a therapeutic value. There's another factor that may be more global and more political. The skepsis or the skeptical attitudes toward prohibition as the only answer for regulating psychoactive substances has grown incredibly. In 2017, a commission at Johns Hopkins in Baltimore has published, to my knowledge, the first report of a medical entity about the consequences of prohibition on people and patients particularly. And they came to the conclusion that this cannot be the only or the best solution for dealing with the risks of psychoactive substances. So political will is growing.
Okay, great. Next, we have Andreas, and asking if you could specify the safety and efficacy criteria of the episode study.
Well,
yeah. So if you mean by that the criteria of who gets enrolled, of course we have criteria like people have to be 25. There unfortunately is nobody going to get in.
Talk about the outcomes basically.
The outcome, but let me talk about enrollment criteria because that's part of safety. Yeah? Unfortunately, people can't be older than 65. Although we get a lot of requests of people 70, 80 years who want to get in. So efficacy, so outcome criteria are about the same that you saw in the psilocybin slides that we presented. So people are measured, the endpoints are Beck's depression inventory and the HUMD. So depressive criteria, then psychological functioning on many levels, questionnaires. Yeah. Safety, of course, is also safety. That's more a process terms. Safety is of course also created by having this treatment being done in safe, in this case, university academic settings that will be at the same time contextually improved so that people will not have to trip in white rooms with people who don't understand how important context is for them. A lot to say about it. If you want to know more about the criteria, just write us an email, or we can also send you that criteria.
One factor in safety also is the occurrence or non-occurrence, hopefully, of adverse events that are being described in all kinds of pharmacological studies.
Inclusion criteria. So people who have a family history of psychosis will not be allowed to that study, of course.
Okay. This is actually related. So this is a question from Tim. What makes people vulnerable to the detrimental effects of the use of psychedelic substances?
So beyond what I've already said, like having a family history of psychosis, we wouldn't treat people with bipolar disorders, not in this study. I know that there is a team at the University of Dresden, for example, who want to be looking at these difficult states too, indications too. So other factors are probably a long history of substance misuse. This study, by the way, is not about substance misuse. Of course, it's about treating treatment-resistant depression. Other factors.
Well, there's this rule of thumb also for people using those substances outside of the clinical setting. What they generally seem to be doing is loosening up structures, making you less composed. And this is good for many people and also many patients in order to achieve development. But if your self is already very, well, chaotic, loosened up, not in a very structured way, it can take you apart, basically. So this is where you have to be very careful on, especially people who self-medicate sometimes underestimate that.
Okay, great. Next we have Thomas asking about communication. As a communication scientist, I am missing the dimension of communication in dealing with the psychedelic experience through, for example, interpersonal as well as interpersonal communication. Is it possible to contribute from a communication perspective?
So I don't know if Thomas is talking about the communication between therapist and patient, or the communication of a study in a larger
He seems to be
society.
talking about intercultural communication in particular.
Yeah. So definitely that's something that we are talking about in the Mind Academy all the time. So people from different cultures, mindsets, traditions, adding to the discourse on psychedelics. What we are actually trying to do in these studies here in the West, more the ideological West, are trying to recreate a space for psychedelics in a postmodern context. I am not, after having looked at ayahuasca and mescaline and peyote uses for a long time, I am not very optimistic that transferring cultural contexts into postmodern societies will do a lot to creating these healthy, safe, and particularly not legal spaces in the West. But I would have to know more about what Thomas means with communication.
The thing is, there's this general problem of putting a non-verbal, sometimes ineffable experience into something communicable, especially verbally communicable. There is no good language yet. This has to be developed. This needs an effort. There are people who turn around and say, listen, I'm not talking to anybody who has not had an experience about those experiences because they won't get it anyway. But this is too short-sighted. I think we also have a responsibility in promoting ways of how to communicate around these topics in the future if we want to bridge to the mainstream.
Okay, great. This is from Mate. I'd like to ask if there is a central database where you can access psychedelic-based quality research data from different fields.
Yeah, there is not a central database, but there are these organizations in the field who have registers. Also, our own website has built a learning base. Actually, I don't think that there will be one central register for psychedelics only. Yeah, so studies like ours and studies like Compass and USONA and MAP studies, they register their studies at central sites. They also need to register at the approval authorities, and that's where you can be sure that something is done that suits the regular procedures in such a study. If you want to look at publications, of course, these are open. You can access most of these online, open access, and we are happy to provide some of the reviews that we're ourselves building on in the follow-up email.
And we also have embedded in our webpage the so-called set of consciousness monitor, where we regularly post upcoming new articles, high quality articles, like being pre-filtered and
always forgetting about our own stuff. Yeah, we have a wonderful team at the Mind Foundation who keeps the publications updated. So go to the Altered State of Consciousness Monitor on our own website and you'll find a lot of these publications.
Apologies to everybody for earlier for the doubling sound. I will mute myself when they're talking now. I'm going to take maybe 2 more questions. Let's see, we have, in Germany, psychotherapists are not allowed to prescribe drugs. Do you have a long-term plan for how psychotherapists will use psychedelics in therapy?
Well, the fact is that for a long time in the future, there will be some role for medical doctors in this, either being psychotherapists, psychiatrists themselves and treating the patients, or other doctors who will supervise and administer the substance while other people could be doing the treatment. So we don't favor keeping this to the doctors. We believe that there are many therapists, and not only licensed, like approbierte psychotherapists, but also people with more alternative training that could be very good therapists with the equivalent of an up training for that. But for a long time, these things will not be happening without a doctor lending a hand.
Let me add to that. Our model is collective treatments. Like in our own center that we're building, and like in the studies, we are actually thinking about multi-professional treatment teams. I don't think that it's necessary, or even that we should wish to have a situation where anybody can administer psychedelics to anybody. So let's build context in which the adult dialogue on these substances can really unfold. And these are collective. These are team contexts where people get a critical and strengthening view about what they do, and not only these individualized therapies.
But we are well aware that there is a tendency within the medical profession, the doctors, to try and keep hold of certain activities. And this is something that needs to be kept in discussion.
Yeah. So well, maybe still adding one thing to that, we are currently in the process of organizing a psychedelic therapist training in 2021, which will be a training in which we take in people with, of course, psychotherapy training, but from different backgrounds and schools, but they will still be trained in a way that they do psychedelic therapies in studies in a team where a medical doctor will be present.
Okay, we have a question from Michael. Is there any plan to perform a study in end-of-life existential distress patients in Europe? If yes, which group and which university? Signed, a palliative care specialist in Geneva who's very interested in this fascinating work.
Well, there is a study that is just being basically finished because they have almost gathered their samples. So Matthias Lichty and Peter Gasser in Switzerland did a 60-patient trial where they had one group being anxiety patients with generalized anxiety disorders, and the other being patients with end-of-life anxiety due to terminal or life-threatening illness. And they have still, I think Peter said today, 6 slots in the end-of-life anxiety section. The generalized anxiety is like full. So they are on the verge of finishing this. End-of-life anxiety is a topic that has been covered in many other, some other studies. I will be talking about that next week in my webinar as well. So if you want to know more about that, this will be a prominent topic of what I'll be talking about next week.
Wonderful.
Okay, I'll just take one more. I always take a bonus question.
Such a question.
Yeah, exactly.
Make it a hard one. Let people grill us,
all right.
please.
I'll try to find a hard one. Let's see. Well, there's a lot of questions about Ovid, so this one seems to be encompassing most of those. Is the Ovid campus also a trial for some kind of secularized meditation centers as part of a Bewusstseinskultur? Why are they designed? Why is it designed round? And and how exactly shall Bewusstseinskultur be implemented in the next years?
Yeah. Thank you for the question. There are more papers coming up at the moment, more research coming up that shows that people with experience in mindfulness also have better results in learning from the psychedelic experience. That's the one direction. And the other direction is that with a lot of people, it happens that through experiencing psychedelics, their mindfulness increases, not in the moment, not only in the moment that they are under the influence of a psychedelic, but for longer, for weeks and months after that. So it makes a lot of sense to practice mindfulness. And yes, I am very eager with a lot of others in the organization to have mindfulness and psychedelic related studies in Ovid. Why is it round?
Why is it round? Well,
yeah.
If you look at the dome structure that we showed you before, there is a center space that could also be used as a communal space, both for group sessions with substances or without substances when we work with groups. And there's these small addendums around it, like smaller rooms that go off the big room where individual therapy could be done. So if you try to combine both a group approach and working with individual people, it kind of comes naturally to have a round structure surrounded by something. And the round structure that we envision is to do with light, with transparency, with glass and wood and plants, and it would give this natural, open, welcoming feature that we want to our clients, our patients to experience.
Which is the aesthetic that has to do with the philosophy that we try to develop. So Bewusstseinskultur has something to do with an open, a democratic, a rational, a science-oriented dialogue, a transparent dialogue with society. Nothing will happen in illegality, and everything is supposed to be open for people to learn and work on them becoming happier and more fulfilled human beings. Why should you have anything hidden from society?
All right, I think we're ready to close out the Q&A. So I guess we'll just finish with the next steps. Henrik, could you pull up that slide?
Oh, yeah. Yeah.
Okay, great.
Can you see it already?
There we go. Yeah. So for everybody here, if you're interested in getting more involved with our organization and the many projects that we've talked about, we have even more that we haven't even been able to mention. There's so many different ways to get involved. One is through our online meetups. We have a Get to Know the Mind Foundation if you want to know more about our foundation meetup every 2 weeks. We also have a meetup for mental health professionals. So if you're a mental health professional who's interested in psychedelic research and therapy, you can sign up for that as well. All the meetups are free. We also have this series of webinars that you just participated in the first one. This is free, free one, but all the other subsequent ones are paid. But they all the money goes towards psychedelic research and therapy. So for a good cause. Other ways to get involved are through internships and volunteering with our organization. We also have a biannual conference so it's every 2 years.
Thank you, Sasha.
Yeah, in case you didn't know. And yeah, that's called Insight Conference. It's in Berlin. Super amazing speakers we have lined up for that. There's also Unimind, which is an academic journal club. You can actually start your own academic journal club at your university. You can do that anywhere all over the world. So if that's something that interests you, we have tools to empower you to do that. And that's supporting psychedelic research at the university level. And then last but not least, we have our Mind Academy. So we offer trainings and workshops. Notably, we have our Beyond Experience workshop, which is focused on psychedelic integration. So I've done it. It was a really amazing and intense experience. I learned so much from it. Highly recommend that. And I think
Sasha, we are just taking Beyond Experience to the web. So that is going to be one of the most amazing, maybe also funniest workshops that have ever been facilitated on the web, because it's a lot about doing things and not only talking.
Exactly. It's an experiential workshop, so it should be fun. Yeah, that's pretty much it. So thank you so much, everybody. And thank you to Henrik and Andrea for taking the time. You can always find out more at mind-foundation.org, and feel free to reach out to us.
Bye-bye.
Bye.
Bye-bye.
Thank you. Bye.